So, good morning. I am Achacooso Deniele from the SN182 and I will be performing a return demonstration in assessing the neurologic and musculoskeletal system. So first, we have to identify our patient to ensure that we are assessing the right patient. So, good morning, ma'am. I am Deniele Achacooso, your nurse responsible in assessing your neurologic and musculoskeletal today. May I know and confirm your name?
My name is Marian Rumapa and I was born in April 24 years and 5.
Thank you so much. And after that, we explain the purpose of the procedure. So, ma'am, the purpose of this examination is to evaluate the health and function of your body movements and support system. Do you have any question? Thank you so much. And after that, we perform an hygiene to remove and avoid the spread of any microorganisms while doing the procedure. And then we help or assess the patient to undress if needed, and we provide patient's gown. This is for proper assessment later on while maintaining the patient's dignity and comfort. And then we begin with the survey of the patient's overall well-being and physical hygiene. This will provide us baseline information about the patient's overall well-being.
So now we're going to proceed with assessing the neurovascular system, which is first assessing the patient's mental status, which is first is evaluating their orientation to person, place, and time. This assesses and evaluates their overall orientation and also for functioning of their moves.
So, ma'am, can you tell me your name, where you are right now, and what date
Can you tell me what day it is?
We are in the hospital and
Okay, can you tell me the date?
date March 14.
Next, we evaluate the level of consciousness. This is to assess alertness and responsiveness of the patient. So, ma'am,
Assess memory, immediate recall, and past memory. To assess responsive memory call to the
Kasi
patient.
nag-evaluate sa consciousness. Imo ba ito i-mention ang level mo?
the level of consciousness, we start from the normal, followed by delirium, obtunded, stupor, and the coma. We have light and deep. And then level 1 is conscious or responsiveness, or the 3 C's, which is coherent, conscious, and cognitive. And then level 2 is the lethargic, obtunded. Level 3 is the stupor, which is patient responds only to an intense stimuli. And then level 4 is the coma. We have the light and deep. Light coma is patient can respond to a intense stimuli or pain, and while deep coma, there is an absence of response even during an intense pain.
Assess memory, immediate recall, and past memory. To assess responsive memory call to the patient.
So, ma'am, did you have your breakfast earlier? What did you eat? What did you have for dinner yesterday?
So now we're going to assess the abstract reasoning of our patient by providing them a proverb and letting them identify what the proverb is.
So,
This
ma'am,
assesses for the patient's cognitive function to figurative languages.
I want you to interpret. I'll be giving you a proverb and I want you to explain your interpretation to this. Okay? The proverb will be time is gold. So how would you interpret that?
Time is running.
Now we assess the patient to follow commands or spoken or written words by giving them instruction. This will assess the patient's comprehension and ability to follow instructions. So, I want you to lift your right arm. Okay. I want you to lift your left foot.
Can you tell me what number this is? Can you point?
Then can you Now we test for cranial nerves. First, we ask the patient to occlude one nostril at a time, and I'll be letting my patient to smell different substances, and I let them identify them. And also instructing the patient to close their eyes. This is to assess patient's cranial nerve 1, which is olfactory, which function is for smelling.
Can you please
Can you close your eyes?
And can you please identify what this is?
Test shoulder shrug and cheek resistance to test for muscle strength, which is accessory the 11 cranial nerves function.
So, I am going to put my hands on your shoulder and I'm going to put my arm this is on the shoulder. Please shrug your shoulder. Hold down. Thank you. Assess for the neck movements, which is this is to assess for the cranial nerve 11, which is the accessory muscles, by asking the patient to move their necks in various directions from chin to chest, ear to shoulder, and also asking them to tilt their head as far as they can.
Okay, so
Touch your chest.
Left to your shoulder,
left and right.
your right.
Ask the patient to close their eyes, place a familiar object, and ask the patient to identify the object. If ability to recognize the object, it is diagnosis. If inability to recognize the object, it is astriognosis.
So can you just close your eyes?
And I will tell you the object.
Just still close your eyes. Okay, like this here. So next, we're going to do the graphesthesia test, which is letting the patient close their eyes, and we are going to draw a number or a letter, and we are going to let the patient identify what this is. This is to assess for the patient's cortical sensory functions. I want you to close your eyes and draw or a number, and I want you to identify. Okay, thank you.
Now we assess for the deep tendon reflex. First, we place our hand on the patient's wrist, and then we tap with a reflex hammer. This is to assess wrist reflex, which indicates cervical 5 and cervical 6. Okay.
Place your hand on antecubital area and then tap the reflex hammer and repeat the other side to assess the antecubital reflex, which is cervical 5 and 6.
Now we're going to place our hands on the tendon muscle of our patient by letting it hang and making it in a relaxed position. This we are going to observe for contraction of the elbows and also for and reflex of the forearm
Kaya tawag nila ang area.
tricep tendon.
Now we place our hand up. We place or we tap on the patella area to assess patellar reflex, which will indicate lumbar 2 and lumbar 4.
Ipadang ko. Ipadang doon.
On the Achilles area to repeat on the other side to assess Achilles reflex, which is sacral 1 and 2.
Ask our patient to dorsiflex and plantar flex their foot with the opposing force. This is to assess for the muscle strength of the lower extremities. So the first thing you are going to do the plantar flexion, which is doing this.
And I go to now we perform the dorsiflex and plantar flex. I want you to dorsiflex your feet. Then plantar flex is 1, 2, 3, go. Other side. And then plantar flex. Go. Next. Go. 1, 2, 3.
Stroke the sole of the patient foot with reflex hammer handle or any hard object to test for abnormal Babanski or normal plantar.
Nurse siya ba ito? Ano, circle ka? Ano ba? J na ba?
For adult and normal for adult is plantar.
Now, we ask the patient to stand and observe the patient's gait, walking from heel to toes and then back from toes to heel. Walking will provide us information about the coordination, muscle strength, and balance of the patient. Okay. First, I want you to walk from your heel to toes, okay? And then come back to me using from toes to heel, okay?
Nasaan yung normal?
Oh,
sige ka.
Normal walk sa kanan.
Paano di mo sa katong dorsiflex and plantar opposite ninyo na left?
Heel to heel. Then toes to heel na sa nung. Toes, heel, toes, heel, toes, heel, toes, heel, toes.
Bloomberg's test. Ask the patient to stand with feet together, close eyes with arms side. Wait for 20 seconds. Observe patient swaying and maintain balance. To test for vestibulocochlear, the 8 cranial nerves which is function, hearing, and balance.
I want you to close your eyes and then arms on side.
In arms side.
So now let us now proceed to assessing the musculoskeletal system, which is asking the patient to extend their arms forward and let them rapidly turn it in a supine and prone position. This will test for coordination of the cerebral functions.
I want you
Extend
to
your arms and rapidly turn
rapidly
prone to supine.
1, 2, 3, go. Now we flex the patient's arm and resist the opposing force. This is to check the patient's strength in their upper extremities. Next.
And I want you to put stress on your arms and I'm going to pull and push inward and outward.
Inspect and palpate the fingers, wrist, elbow, and arms to identify joint abnormalities, tenderness, and swellness.
So now we're going to ask a patient to squeeze both of our fingers. This is to assess for muscle strength in the upper extremities.
Okay, I want you to squeeze my fingers. You squeeze my fingers.
As fast as you can.
Now, we ask the patient to perform the straight leg test with one leg at a time. This is to detect or identify any irritation in the lower back.
So I want you
To
to
stand
stand.
and I want you to straight one leg at a time. Okay. 1, 2, 3, left, some right. Right now, 1, 2, 3, go. Next. Left.
Ask the patient to move one leg laterally, which is abduction, and medially, which is adduction.
And then following the abduct, there's a right and now 1, 2, 3, go abduct, abduct, next. Abduct, and then abduct. Come 1, 2, 3, abduct. Okay. Adduction.
Our patient's thigh muscles, which is applying force. We are going to push inward, outward, and also inward and outward, and we are going to test for the patient's muscle strength in their thighs and in their lower extremities. So we're going to push inward and push. I want you to push force or resistance outward. And we'll push.
Follow the procedure. We may assess the patient to a comfortable position to avoid causing discomfort to the patient after the procedure. We perform hand hygiene again to remove and avoid the spread of any microorganisms after the procedure, and then we document the findings of the assessment for legal documentation and continuity of care. Thank you.